Welcome to Frankly Speaking with Dr. Wade. This show was created for and inspired by the thousands of patients I've served. So it's time for me to speak up and speak out on their behalf. With a wide range of experts, we bring you weekly insights diving deep into topics of controversy to bust through the sugarcoating that keeps you and your family stuck in the mainstream. Hi, I'm your host, Dr. Wade. Today we're going to get serious about issues that get in the way of you getting the best out of your tissues. Hey folks, so today I want to talk about some dynamics, a dynamic between the doctor and patient that really comes up in terms of dialogue with patients on a regular basis. And some of it's patients interacting with me, and I don't know if I bring some of this out or whatnot, but patients will share with me certain scenarios and ask questions as to why that happened or this happened. I can't speak for their previous experiences. I don't know. I'm not claiming to have all the answers for those, but what I do work on, and I have for years, is communication styles and understanding behavior. As a behavior analyst for years of study through the DISC model, is that people are pretty predictable in behavioral styles. And if we can adapt to them, if I can adapt to them, my staff can adapt to them, the patient feels more heard, the patient feels as though they're understood, and ultimately that allows us a chance to help them versus going into a situation or an experience and you're just frustrated because the people aren't listening in the systems. One of the stories where this started, there's a couple different segues, but someone dear to me had an issue. They drove a piece of metal into their thumb and it dug into the nail bed. Well, it was pretty painful and it was underneath the skin, so they couldn't get it out. So they ended up going to the emergency room. Well, on their way into the emergency room, there was check-in, and then there was triage, and then there was questions and vitals being taken. And then they discovered that she needed to move rooms. So this is how inefficient the healthcare system is. And again, not trying to step on any toes, but the bottom line is emergency care is fantastic, but it's very cumbersome, very non-communicative, which means there's a lot of time wasted, and there's a lot of redundancy, which is, again, unnecessarily driving costs higher than they have to be, paying more people for doing what they do, blah, 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 and so on and so on. And so it turns out that literally there was 5 or 6 room transfers and 5 to 6, literally the same amount of testing and reevaluating being done instead of just passing that information on or having it into the electronic healthcare records. And anyone who just pulls up that file is accessing what's been done prior that day. So they're not redoing things, wasting anyone's time. So basically, this person ended up not getting any of their needs met that day because they couldn't decide what to do. They were unwilling to help. They were afraid to help. The doctor came in, said, "You're going to be fine," walked out. The PA was unwilling to pull the metal piece out. And so my family member walked out of the ER and said, "We're done. You can't, urgent care, you cannot help me." And they, grabbed her, tried to not let her do that. And she just said, "We have other things to do and you're not helping me. This is a waste of my time. It's a 3-ring circus." I'm here to say we could be better at communicating. We can always be better at listening to patients. We can look at our systems. And I'm a big systems guy. So I have this natural affinity to creating systems and making it efficient. Otherwise, I feel like I'm wasting my time and I'm not learning anything. And so in this case, when there's 3 questions I want you to be able to have answered, but I also want you to be able to not be afraid to ask your doctor. So first of all, you as a patient have the right and deserve to be heard. Like, what are you here for today, and what are your expectations? And then, why the urgency today? If this brings you in today, what prompted it? And I literally start simple. So I'm going to backtrack just a bit so you kind of see how this plays out and the importance of it. Because again, I don't want to just data dump. I want to connect some dots for you in terms of how you, in your healthcare experience, can start winning by getting what you're after and actually commanding. You want to actually command more respect. You don't want to demand it. You want to command it. So just your presence, you have the right to communicate and express yourself and be heard, as well as ask questions. Now, that said, I'm a caregiver. So what do I want? All this confrontation with a patient every time? Don't. That's not what I'm saying. I'm not saying confrontation. I'm saying I'm going to ask you questions because I want to know where you want to go. There's something assumed in healthcare that you're here, I'm the expert, and I'm going to fix you. That's not necessarily what happens in my office. That's not what happens in my practice. My practice is an interview, and then it's questions, and then it's answers, and then it's an invitation. That's what it is. I'm going to interview you first. I'm going to see if I can help and if we make a good fit. And then I'm going to ask questions about what it is you want to see happen and when, what are your expectations? And then how do we go about it? How do we go about getting you where you want to be in what kind of time frame? And that sets the stage for you as a consumer to win. And how do I not win when you win? Exactly, right? So the first 3 questions I have for a patient once we gather a full case history. So mind you, my staff is certified and trained to take a thorough case history and gather all the information about what you're experiencing, how long it's been there, where it radiates, what makes it better, what makes it worse, and then they'll brief me on that process, let me know what's going on before I go in the room. Then they introduce me to the patient and I start. So they fill me in exactly as to what's going on and where it is and the timing and all that. And once I go in, they introduce me to the patient and I begin with my 3 questions. And those 3 questions are directive. Number 1, I don't want the patient to have to repeat anything they've already said, which happens way too many times in way too many doctors' offices, delaying the whole process. Repeating. It does not feel good to have to repeat it. This is like when you call the credit card company and they ask for all your information, and then you get somebody to finally answer, digitally that is, and then you get someone to answer and they do what? You're right. They ask you for the same information again. It's like, what was the point of me giving that at first to nobody? In your opinion, what do you think is happening? The patient then will say something like this, and I'll keep it brief. You know what, doc, I think I have a pulled muscle. You know what, doc, I have, a history of this chronic low back, and I just think it's out, and it comes and goes, and it just usually takes care of itself, but this time it's not leaving. Or, you know what, doc, my wife made me come. I really don't want to be here, and I don't think you can help. Yes, that happens. Or it could be, you know what, my significant other is worried about me, or she thinks it's nothing and it's just muscle spasms and they'll just go away and I should take these painkillers. You see, each one of these answers tells me a little bit more about what that patient's, first of all, perspective is, and secondly, what their take on it is. Because if I get blasé and I get nonchalant, or I get real concern and I get worried, or maybe it'd be like, you know what, I think these migraine headaches, I don't know, I think it might be a tumor. And so what's the importance of me knowing that as a provider? I want to help that patient alleviate their stress. I want to find out if it's actually something like that. And if they're urgently feeling that way, then I'm going to run tests or be prepared to move a direction that actually helps get to the bottom of that worry first. Otherwise, if I don't address that concern, then the patient's not going to feel heard or understood and not taken seriously. And I take that very seriously. So as a patient, I'm telling you, you should take that seriously. You should expect your doctor to take you seriously. The next question is, what are your expectations as a result of this visit? In other words, what would you like to see happen as a result? And maybe the patient responds like, you know what, doc, I want you to fix me today. That's good to know. Or, you know what, I just want to know what's going on and maybe have a plan of actions so we can take care of it. Or I just want to know if I have something out of place and you can give me some stretches or exercises that I can do at home. Or here's another one that's also fascinating, but it's there and we allow it as a choice, of course, because it happens. And that is, hey, doc, I want you to help me with my pain today, if we can even just get some answers. But then I want some treatment without having to do anything on my own outside the office. Yes, that's an awesome answer. It's awesome because they're being real. And you know why I love this answer and why I love that communication style with a patient is because how many times do doctors or providers of other sort literally just say, it could be therapists of any sort or MTs, massage therapists, which I'm big fans, by the way, of. all their work. And so, but what I hear is this assuming what the patient always wants. Like, you know what? You just want exercises, and that's how I fix problems. Is I diagnose your weakness, and then I send you home with exercises. But sometimes patients want actual care. They literally want your help, and that it doesn't mean you give them help when you can't, when it's not necessary. It's just that, okay, I'm going to be frank. If there were an exercise that you could give them that would solve the problem, give it. But everybody does not want an exercise. I'm going to throw a stat out here for you that 3 to 7% of exercises that you prescribe to send home with a patient actually get done. What an awesome statistic. What an awesome emphasis of energy to give readily exercises that never will get done, that rarely ever get done. Or they might get done for the first 2 days and then they're not going to be done. And what gets chalked up as a perception to the patient? They didn't work. That means your thought process, me as the doctor, my thought process to solve that patient's problem with an exercise wasn't even what they're asking. So how about I ask what the patient wants and what their expectations are? I think that's fair. It helps me help them. And that's what this is really about. So if you felt a little fervor, it's because I hear this constantly from patients, and I get that. And that's why I care about making a difference with it. I have been blessed, and I've had the opportunity to teach postgraduate and graduate students and doctors as a clinical instructor. My experience with the clinical side of things is that in the communication style, many times we're lacking the ability to communicate clearly with patients on what their needs are and what they want. And many times it's not asking questions, or it's assuming because either they feel like the doctor should know. So the ultimate message here is that we always can improve. Patients need to understand that their doctors aren't perfect, and that's okay. They're human beings, and they're worried clinically about many different things that oftentimes is, occupying their RAM, their random access memory. And so they're not of superhuman capacity. They're human beings with challenges, with personal issues, with skill sets. That said, I'm not making excuses for providers. I'm literally allowing you to interact with human being with a different perspective, or maybe an open perspective, but to allow you also to empower you to ask better questions and to know that you deserve your questions answered and you deserve options. By the way, I am a patient. I'm like you. I'm a patient. And when I get adjusted, or when I go get care anywhere, or when I get a massage, or when I see a provider, when I meet, whether it be a therapist, a counselor, a psychiatrist, a psychologist, whether I meet a dentist, I am a patient as well as a professional. So I'm taking notes, I'm listening. But when I'm the patient, I want to be heard. I want to be respected. I also am respectful and considerate to the doctor that's taking their time and serving me and I address them as doctor. Why? Because I'm the patient. I'm sharing this with some passion, because that interaction, that dynamic is vital for you to be able to heal and mend and have a solution to whatever you're dealing with. If you can't have this interaction and respect the person you're working with, it's really, really tough for that doctor to be a healer, to help draw out your most healing capacity. So I love the fact that as a patient, you want to be heard, you want to be listened to, and you want to know that someone on the other end actually cares. I mean, really? That someone cares is not a small thing today, in today's day and age, with our short attention spans. So the third question that I want you to be aware of, to both from a patient's perspective as well as a doctor or professional's perspective, is that what's motivated you today? So if you show up in urgent care, it's pretty clear. You got a glass shard in your thigh or in your arm. It's clear why you're here today. This just happened. That's what urgent emergency care is for. But when you're walking into a chronic care facility, it's a primary care as a chiropractor's office, or let's just say it's a naturopath, or let's say it's an acupuncturist's office. When you're walking into something where you're dealing with a holistic provider, your limb is not typically falling off at that point. You're not, you didn't have a chainsaw wound that needs addressing right now. That's that's not our scope. You're better off in urgent or emergency care. So we're talking about what you might have been dealing with chronically, like in most cases. So someone with digestive problems, autoimmune problems, whether it be chronic back or neck or musculoskeletal aches or pain, sciatica, disc problems, arthritis, diabetes, and you're looking for dietary help and changes or holistic care and supplementation along those lines. These are all forms of chronic care where medicine, literally in the mainstream model, Western medicine wants to medicate you, or in terms of drugs, that's big pharma's role. So when we ask the question, what motivated you? So why today are you here? In other words, if this has been going on for the last 6 months or 2 years or 10 years, why today are you here? What promulgated this visit? That answer is significant because it could be something like this. In many cases, these are examples. Hey, doc, I'm afraid that I'm not going to be able to see my grandkids grow up and that I'll be able to, play with them. Or, I lost my wife 6 months ago, 6 weeks ago, whatever it might be. And I'm just afraid that I'm going to end up like her, for that matter. Another example is I could be tired of a chronic problem that's been happening for some time, slowly losing the feeling in both hands, and now it's affecting my sleep at night, and it's getting in the way of work. Thank you. Now I have something to go on. What is motivating the patient to take action? Because there are times where the patient says, hey, doc, I don't know. I don't know if you can really help me. I really, my significant other wants me to be here, and I don't really think you can help. So might not seem as relevant to you as a patient, I'm not sure, but these are dynamics that go on. And what I'm trying to help solve is the patient that's stuck with an experience of not knowing what's fair to expect anymore. And I think it's a shame. I think it's a shame to have a relationship or not have a relationship with your doctor where you can ask questions and your doctor knows you, understands your behaviors, your habits. And actually, my opinion comes by what I know of my patients. And it's different for each one of them. I don't have a blanket recommendation for every patient. And I say that very, very sincerely, meaning, for example, we have a keto program in our office, and it's quite significant in terms of what we've been able to yield with results. But I have people ask me all the time who have gallbladderectomies and whether they can handle that kind of fat or whether they do it. And there's some I just steer and say, look, you're not in a position to do this very safely. You're higher risk. Now, can we work towards it? I'm happy to help that patient work towards it. But the truth is we have to respect their current health status, which means it's individualized. It's not generalized. And that, again, is where I feel healthcare has lost its way. And there are many cases where we will talk specifically about diet when I teach classes and programs, and that is about understanding, again, the big picture of proper digestion, how enzymes work, what the body does, where things go wrong, and where you can troubleshoot them, and then how to solve that problem. And it could be, there's patterns, of course, that are repeating, and then there's uniqueness within those patterns where you fine-tune and you personalize the program of care because of the patient's unique makeup. So in the end, what I'm really batting for is the patient to be able to feel heard and have a better experience, and that you have a healthcare system that's overburdened with challenges, and it's not going to get better by itself. I mean, it's going to get better when we as consumers, as patients, unless we ask and we learn that to communicate, we want to ask better questions. And as a provider, I want to ask better questions for my patients. I want to do a better job. I'm always trying to, and it's not like your healthcare providers aren't as well, but I see them more overburdened by the stress of the system and remaining compliant and all the compliance and the HIPAA and guidelines that have to be followed, that we've lost that personalized touch. And that's the hard part with automation. That's the hard part with some of the innovation. And we have to re-innovate while we grow, while we expand capacity and the digitization of it all, and maintain the human touch and eye contact with providers so that there's a real human experience rather than somebody just documenting into a computer while you're talking at them. So my parting thoughts with this is that you as a patient remember that you need to ask questions. You need to be your best healthcare advocate, and watch for an upcoming episode regarding on how to become your own healthcare advocate and to become your best, basically, health warrior. You have to become your own health warrior for you and your family. And that's going to unfold as to what a health warrior looks like and how that behavior is definitely trending up in terms of empowerment and knowledge, so you can navigate your way through a mainstream healthcare system that has a completely targeted agenda for you. Until next time, my friends, be well. As always, I just want to thank you so much for listening to this week's episode, and I look forward to our next time. Okay, my fellow health warriors, it's time to head over to iTunes, frankly speaking, drwade.com. There, you can rate, review, and subscribe, as well as share, so more of our brothers and sisters can grow to realize their voice and their health. Speaking up means you matter. We'll see you next time.